I usually have music, so.
You can sing.
I mean, I'm going to pull it up.
Boom.
I'm going to mute myself.
Yeah, me too, until it's my time to go.
All right. Hi, good evening, everyone. We're going to give folks a couple more minutes. They are piling in, and I want to make sure that folks get settled in with their technology before we get started, but welcome.
Can you hear it?
Welcome, everyone. We're going to get started just in a few minutes. Thanks for being here.
I could have kept the music rolling.
Okay, so it's 5:04. We're going to honor your time and the time of our panelists, and we'll go ahead and get started. First of all, thank you so much for joining us this evening. And this is a really, really important topic. And just to kind of name, we have providers that have joined us from all across the nation. As I was taking a look at the registration list, we have folks from all over, not just California. And you know, that just speaks volumes as to the fact that we as medical as well as behavioral health providers really need to be equipped about how to articulate the science behind vaccines and how to support our patients and families as we're shifting into this phase of the pandemic. So everybody, welcome. My name is Deborah Sun. I'm the Executive Director with the National Association of Social Workers California Chapter. NASW is actually the largest professional association for social workers in the nation as well as the world. California Chapter has approximately 9,000 members in the state. So our reach is extremely broad, and you know, what we really do is lean on our members in the broader field as well as allied professionals to learn about what types of supports we need to bring to the field. And this is actually something that bubbled up. A lot of providers were sharing with us that they are having these conversations in the context of their work, and they want to learn more about the up-to-date science and be able to articulate how, you know, what the science looks like, what the experience actually looks like for the people that they serve, and particularly what this experience is like for folks of color. Our Black and Brown communities are disproportionately impacted right now, particularly in light of the vaccine rollout, and how do we support them in these conversations as we're honoring the harms of systemic racism, the history of harms that our healthcare systems and other systems have caused on our communities of color, and integrate that into the ways in which we support them as individuals and human beings. So moving forward, the agenda is basically we have about an hour and 15 minutes with you all. I'm going to have our panelists just briefly introduce themselves really quickly. I will prompt them, and then they're going to give some presentations. And if anybody has a question, please type it into the Q&A box, not the chat, but the Q&A box. That way we can track your questions more intimately. For anybody receiving CEUs, please sign into the Google Doc that I put into the chat. I'll paste it again after I stop talking. That way you have it just in case you came a little bit later. Some housekeeping, this is being recorded, so we will make this available after the event. And we'll email that out afterwards with the evaluation. Dr. Clara actually does have a PowerPoint, which will also be emailed out after the event as well. And again, please type your questions. I know folks are having a lot of curiosities, and we really want to make sure and try to address them as much as possible during this event while we have our amazing panelists here. So it's absolutely my pleasure and honor to introduce our fabulous panelists tonight. And we are very, very fortunate to have such a diversity and wealth of experience here in this space. So we have a lot of folks with the last name Williams. So I'm gonna actually, for the ease of reference, reference Dr. Clara Williams by Dr. Clara, and then Dr. Marcus Williams as Dr. Marcus, and then we have Leticia Vaca on the stage as well, and our fabulous NASW California intern Kristen Williams, who will be supporting the event. So thank you all so much for being here. So really quickly, just to do introductions across the board, Dr. Clara, would you mind introducing yourself?
Yeah, my name is Clara Williams, and I have a PhD in biochemistry and biotechnology.
Thank you, Dr. Clara. And Dr. Marcus Williams.
Hi, everybody. Thanks for having me. My name is Marcus Williams. I'm currently an emergency medicine physician working at Sutter Health in Oakland. I received my MD at UC Irvine School of Medicine back in 2012. Oof, a long time ago. Thanks for having me.
Thank you, Doctor. And Leticia Vaca, who is actually our LCSW joining us as well from Urban Health Group. Leticia.
Yeah, happy Social Work Month, everyone. My name is Leticia Vaca. I'm the CEO and founder of Urban Health Group. We support Black, Indigenous people of color, planning for medical emergencies. So any opportunity to talk to the community about issues that are unique to this population, I'm here for it and happy to discuss the implications around mental health.
Thank you so much, Leticia. So we're going to pivot directly into the presentations, and Dr. Clara, go ahead and screen share if you're ready.
Okay, one moment. Does everybody see the screen? Okay, good. Okay, so I'm going to start, and I'll be talking about demystifying the coronavirus vaccines. And of course, this is important because the vaccines will help to reduce the spread of the virus. And in general, the ways in which coronavirus has affected people has not been very democratic. As you can see here with the graph, people of color have been disproportionately affected by coronavirus. You can see that the blue, which represents Native Americans, the blue and Blacks, and the yellows for Hispanics have a higher incidence of hospitalizations due to coronavirus compared to whites, Asians, and Pacific Islanders. So one of the ways to help with this, of course, would be vaccinations, because this will help to reduce the spread of the virus. I'm just giving a brief history of vaccines because in general, I think we're not used to seeing a lot of these diseases which vaccines have helped eliminate, such as something like smallpox. I just want to go over a little history. So it actually all starts with Onesimus, who was an enslaved African, and he's the one who actually helped bring this idea of vaccines to America. There was an outbreak of smallpox in Boston, and he actually told his master about previously when he was in he had a small inoculation from someone's pus with smallpox, and then he was able to build up this immunity with it. So this kind of takes on the idea of more traditional vaccines. So in more traditional vaccines, you would have this weakened virus or an inactivated virus, either through chemicals or by passing it through an animal. And then essentially you take this weak virus and then you would get vaccinated. And then this would allow your immune cells to come and build up the appropriate immune response. And then sometimes, hopefully, this would build an everlasting immune response. Now, with the COVID-19 vaccines, I included these three, Johnson & Johnson, Pfizer, and Mrna, because these are the ones that are FDA authorized. Of course, there's more, but I'll just talk about these three. So the Johnson & Johnson, the type of vaccine is a viral vector. In the next slides, I will talk about that. It works by teaching the immune system to attack the protein the virus uses to infect other cells, and the instructions are carried by a non-dangerous virus. So the effectiveness of this is 66%, but I want you to remember that this efficacy basically isn't for something like the hospitalizations or death. This is more for, are there symptoms in the patient? Do they have a fever, right? Are they displaying signs of coronavirus? So just go over that briefly. Also, the person needs 1 dose shot for the Johnson & Johnson. So Pfizer and Mrna are both RNA vaccines. So I'm going to talk about them together because they're very similar. They both use RNA to teach the immune system to target the virus's surface, preventing infection. So this effectiveness is about 95%. And then for Pfizer, you need 2 shots, which are 3 weeks apart, and Mrna, you need 2 shots, which are 4 weeks apart. So we're talking about these RNA virus, but what is RNA, right? RNA is something we have RNA within us, right? RNA is this intermediate between DNA and protein. So DNA basically stores the genetic information of your cells. And then this intermediate mRNA is a temporary set of instructions for cells to make proteins. And then proteins, of course, form the all the functional building blocks within the cells, right? So, your hair has protein, you might want to eat protein because, you want to be stronger, right? So we know what all these things are, and they're nothing to be afraid of. So how does the mRNA vaccine work? So right here is the coronavirus. And as I had mentioned, protein, so the coronavirus has this spike protein, you can see it here. And then remember, with mRNA, it comes prior to the protein. So what the vaccine has in it is the mRNA, so the step prior to the protein. And mRNA is unstable, so you need it to be enclosed within a lipid nanoparticle. So that's what's in the vaccine for Mrna and Pfizer. And then you have this vaccine injected into you and your cells, and then the mRNA is able to make a protein using your own machinery, and then you would express then this spike protein. And this would happen for a few days, and then it allows your body to build an immune response. And then let's look at the vaccine efficacy for the Mrna and the Pfizer. And I think this graph is very nice. If you look over here, you see Mrna in blue and Pfizer in the red. You have the placebo and the vaccine for both. So placebo means there's nothing, and vaccine means the person was vaccinated. And if you look here, you can see that in the dark, blue and red for the placebo, you have this cumulative incidence of COVID occurring, right? So after the shot, if it's a placebo, you have COVID in people, whereas with the vaccinated, it's basically at 0, right? So nobody who's vaccinated will have COVID, which is really good. So how does a Johnson & Johnson vaccine work? It works a little bit differently. So it's actually a non-replicating viral vector. They use the adenovirus. So the adenovirus sounds different, but actually it's really the viral virus for the common cold, right? So they take this virus for the common cold, they change it a bit, and they also add some genetic material that will allow the adenovirus, it's like a weak virus, and allow it to kind of put on a costume and be the coronavirus by having these coronavirus spike proteins, right? So when this vaccine is injected in you, then the adenovirus with the spike proteins is then seen by your immune system. Then you have the appropriate immune response where you'll be more likely to respond to coronavirus if you have it again, right? And I also want to make clear that with the Johnson & Johnson, before it said 60% effectiveness, but if you actually look at the efficacy for severe hospitalizations and death, which is what we really care about, it's at 100% effective at preventing these things. So Johnson & Johnson is also a really good vaccine, and it's only 1 dose, which is nice as well. So what can you expect post-vaccination? So you'll have possible symptoms include pain at the injection site, fever, headache, fatigue, muscle pain. However, you need to remember these typically resolve within 48 hours. These are actually signs that the immune system is working and you're building immunity. And then also for Moderna and Pfizer's, these mostly would occur after the 2nd dose. And I picture here, this is Dr. Cobit, and she's actually the lead scientist at NIH Vaccine Research Center. And she was really key to creating the Mrna vaccine. And she herself is, of course, happily getting vaccinated, and she wants to stay safe, and she's proud and grateful for all the work she did, and she's getting vaccinated, of course. And not only did Dr. Kizmika get vaccinated, but more than 100 million vaccine doses have been administered in the US. Right now, Pfizer and Moderna are higher, but that's because Johnson & Johnson was just approved, so I assume that would go up. 64.1% of Americans 65 and over have received at least 1 dose of the Covid-19 vaccine, and now 21.4% of the United States population has received at least 1 dose. So people are considered fully vaccinated 2 weeks after their 2nd dose in a 2-dose series like Pfizer, Moderna, or 2 weeks after a single dose vaccine like the Johnson & Johnson. One of the things I do want to touch upon, because there are all these new variants, right? And I really did like this graph over here, because you see the orange right here, this orange one, this D614 SARS-CoV-2 variant is the one that originally arose. But by May 2020, there's actually a new variant, this blue one over here, the GS14, and that one completely switched. So we really have to still be careful about the variants, because as you see here clearly, they can switch and change the transmissibility and which one's being transmitted more. And we're still learning the efficacy of the vaccines against new variants of the virus. So, of course, you always want to make sure to continue to follow the CDC COVID safety guidelines. Even if you are vaccinated, you still want to make sure to wear your mask, stay 6 feet apart. You want to make sure not to gather in large groups, keep washing your hands, and do remember too that it's actually a privilege to be vaccinated. In America, of course, we're all very grateful, I would assume, to be able to receive the vaccine. It seems by late 2021, we should all be vaccinated. But if you look at other countries, like the whole continent, or not countries, the whole continent of Africa, many countries in Asia and Eastern Europe, they're unable to get the vaccine. At the end of the day, you only have so much materials for creating this vaccine. So of course there's limited supply. So it's a privilege to be vaccinated. And thank you.
Thanks so much, Clara. I'm actually going to ask this question because it came in through the Q&A and it's related, and I think you'll be able to easily pivot into it. I think you answered it, but if there's anything you wanted to add to kind of bring it down to layman's terms so that providers can be more articulate about it. The questions are, what is RNA? And you did talk a little bit about that. And does RNA change your DNA?
RNA will not change your DNA. RNA is relatively unstable. What RNA, the actual name is ribonucleic acid, right? You want to know the name of it, the technical name. But RNA, as I said, is an intermediate. So you have DNA, you have RNA, and you have proteins. And RNA is an intermediate. So the RNA is going within a few days, within about like a week, everything that was injected in you is gone, right? Now, all you have is your immune response being able to recognize and know that coronavirus is harmful. That's all that is. It's an invader. That's what you have. After like a week, it's gone, even like a few days.
That's helpful. Thank you.
There is one more question here. I'm trying to put in the Q&A, but I will ask it. It says, if somebody has no reaction from the 2nd vaccine, does that mean they may not be protected?
No, of course not. No, that's not true. Just not having a reaction, it just depends a lot on how, because a lot of the reason why it's your immune response, right? It's your body reacting to it. So if you actually have a really strong immune system, a lot of times you'll have a really strong reaction. If your immune system maybe, it actually tends to be like if you're older, your immune system might be a little weaker. But whereas if like actually young females tend to be the ones who have the strongest immune system, and then you might have a slightly stronger response, but it varies. I've known a lot of people who are vaccinated and it just seems to really vary. Some people have reactions, some people don't.
I couldn't figure out.
You are protected from it, even if you don't.
Great. I couldn't figure out how to type that into the Q&A, so I wanted to just ask that question for one of our members.
Thanks, Kristen and Clara. So Dr. Marcus, we're gonna shift into your presentation.
Yeah, no, thank you for having me. And Clara, thank you for that great biological explanation, really helpful. I thought that was great. Really kind of hones in on first a lot of the questions that we do get, especially myself being an emergency medicine doctor on the vaccine. Is it going to change my DNA? You know, what's going to be the downstream questions or downstream side effects? A lot of those questions, a lot of those answers are hard right now. But I think Claire really kind of helped us understand that one, mRNA is a copy of DNA. It is not DNA. It is not going to go into your DNA. When you get the vaccine, I like to think of it like an egg that we eat and we crack. So, you know, when you get a vaccine, the vaccine is going to go into your cell. Okay. Now think of the nucleus where your DNA is as the yolk. The vaccine is not going to go into the yolk. The vaccine is going to stay outside in the cell, use some machinery like Claire taught us to make this protein that then goes out of the cell, and other white blood cells or immune cells then use this protein to help make antibodies, help make other cells that will then remember COVID down the line. So they take this protein that Claire showed us, they make a cell that we call a killer cell. This killer cell stays around for years. So when you get COVID in 2023, hopefully the COVID that we're all talking about now and not some other COVID, your body will be ready to respond to that. And then like Claire discussed with Johnson & Johnson, it uses a very weakened virus. Okay, I get a lot of patients are concerned that Johnson & Johnson is going to make me sick. Is it a live virus? No. Is not a live virus. You are not going to get COVID from any of these vaccines. I think that's another point that Claire made that I think is very important. With the Johnson & Johnson, like she said, they're using a weakened virus. And that weakened virus is then using very similar methods that the mRNA was. It's using proteins to make using your own machinery, to make this protein and go forward. And I think that really helps patients a lot in understanding just a little bit of that machinery work and how your body's working, and you know, understanding that your DNA is not involved. A lot of other questions that I'm getting, especially from our Black and Brown population, is concern about government backlash or government true insight on what they're doing with the vaccine. You know, kind of going back to situations in which you know, people specifically of Black and Brown skin color were not you know, appropriately treated. You know, going back to Tuskegee, you know, when gentlemen were, you know, thinking that they were appropriately getting treated for syphilis, but were not. You know, the government and other institutions were involved in that, and people understand that. People know that this is not you know, something that's not been known. So they bring this up, and it's rightful questions. I think it's important to understand that you don't have to have the answers. You don't have the answers. I don't have the answers. You know, these things did happen. I think it's important to acknowledge that and understand that. But the best thing to do is just to go back to the topic that we're at right now, the facts that we have right now. This vaccine seems to be working. Claire just showed us that. I can tell you from being in the ER since the vaccine has come out, the severity, kind of, as again, like Claire was talking about, efficacy, how many symptoms you're having, how affected you are, those have decreased. Am I still seeing COVID positive patients? Yes. But the severity, the amount of times these patients require machines to help them breathe or other medications to keep their vital signs stable has decreased in my sense. And I think that's important to know. I think that's important to try and express to patients, up forward, a very close and upfront. And I think there's a lot of other questions that people have, as far as side effects that may come down the line. And, mothers are concerned about autism. And that kind of goes back to, I believe, measles, mumps, and rubella vaccinations. And, right now, all you can say is that was something that was determined on a long-term basis. We don't have the information to make or answer those questions. And it's not dancing around. It's kind of where we're at the current process. We're very early on in this vaccine administration, like Claire just showed us, and things like that can't be determined right now. All you can say is that, right now there haven't been any cases of autism. There have been no linked cases, and kind of just go on the facts. And I think that's I think that is the most important thing that we can do with patients in answering their questions, making them feel more comfortable. Yeah, I don't know if I had any questions that popped up there.
You have a lot of questions, a lot of good questions, but I think I'm going to wait till the end so that we can get to Leticia's. Yeah. Thank you, doctor.
Yeah, no worries.
So Leticia, go ahead.
Yeah, I think this form is really important because there's a lot of information. Folks are seeing it on TV, they're seeing it in social media. And I think in a sense that folks have become desensitized to how severe this virus has been, how it's impacted the community. And then there's been a lot of conflicting information. What do I believe? Naturally, we had a conversation before the webinar started around, no, I don't want to get a shot. No, I don't want a vaccine, but I also don't want COVID. So how do I make a great choice in my care? It's been really difficult when it comes to managing your health needs, your mental health needs. This was already a struggle in our community prior to COVID. It's been exacerbated by what we've seen as like a scarcity of resources and not a lot of answers. That is really frustrating as a consumer. It's really frustrating as a potential patient, where I'm seeking the industry, the healthcare system for answers, and they cannot answer it clearly, or you're getting a lot of distractions with like anti-vaxxers, or not even anti-vaxxers. You could be anti-vaxxers, but the conspiracy theories around what has happened. We're looking in our community, the backlash around, the Asian population with despairing that Asians have caused this, right? So there's a lot of distractions around the virus and the vaccine. And I always encourage folks to find one source where you can get some reliable information. Now, everyone has been talking about the CDC as the leader, the go-to person. But when we look at communities of color, Black folks specifically, the CDC has also been involved in harmful treatment towards Black folks. So the apprehension that folks are feeling, the confusion, the lack of desire to be as engaged, I get it. And it's going to be a very personal choice on whether or not you choose to vaccinate. I recommend exploring reliable resources. The information is changing every day. These numbers that we have now, they will probably be different tomorrow. They will surely look different next week. So being informed means that you have to stay on top of this information. If you're not in the healthcare industry, it's very easy to kind of like fall off and be disengaged from it. But we're seeing in the US how misinformation, confusing information got us to where we're at now, where there's over 500,000 deaths because of this virus. So I don't know if I can give you words of encouragement, but I would say seek a reliable source that you can go to. Most people rely on their family and friends. So maybe they're not going to read the news, but they'll ask their best friend because they know, they're connected. With my company, Urban Health Group, we're not going to tell you what choices to make, but we will make sure that you have all the information you need to make the best choices. So platforms like this, having someone sit down with you and really explain this really complicated virus and the options for care, Urban Health Group has positioned ourselves to provide safe spaces to explore these questions. You're not going to always be in a forum. You may not always have that availability. So how can you still get your questions answered if there is an answer, or safe space to explore how you may do that? I, for one, there's a local healthcare agency called The Roots here in Oakland, and I follow whatever their director puts out. She's really impartial, but she also is mindful of the social justice implications around Black, Indigenous people of color. And so she'll put an article out of updated information around the CDC, especially around, do we wear masks or not wear masks, to continue to encourage folks to remain safe, because it's not completely managed. There are these mutations, there different variants of the same virus. And what would that look like going forward? It has impacted every industry. It has impacted every facet of our day-to-day life. These forums are important. Whoever is here, I hope that you're talking to your family and friends. I'm not a scientist, so I super appreciate Dr. Clara Williams to break down it. I'm in the field, but that's not my lane. Having someone like her break it down for me gives me reassurance. And so you're going to want to check in with your body around, does that feel good for me? Is that good? Because we're not going to always get the clear, straight answers. So being informed and feeling empowered to make really great choices is going to be important.
Thanks so much, Leticia. And I think, what you're speaking to, as well as Clara and Marcus, is sort of this dichotomy of experiences that we're experiencing, right? Amid racial tensions, amid the pandemic, as we're trying to reconcile, the human experience. And we're also service individuals, or public servants, so to speak. And so how do we balance those things in terms of the sort of introspective experiences that we have to have, parsing out science from the messages that are being pushed out, and then be able to articulate them externally with the folks that we serve and our loved ones. So I think all of that resonates with our audience. So we're ready to pivot, and thank you everybody for turning your cameras on into the questions. We have a lot of really great questions coming in. So Kristen, can I invite you to start posing the questions to the panelists?
Absolutely. Thank you so much, everyone. So we have some great questions. So I'm going to just go down the list. So our first one is, how long will either vaccination be effective for? We have actually two. How long will the vaccination last, and how long will it be effective for?
They don't know, right? I think that's a big thing right now. This is new, so there's no way to know how long it would last. What I've read recently is that 6 months it's been shown to last, but that's because they've had it for 6 months, right? So I think it's really hard to say.
Yeah, no, I'd probably piggyback on that. There's been talk about possible boosters. And I think that will depend on kind of how the vaccine changes. As far as time limit for vaccine now, I don't have any information on that. I would expect that the duration would be somewhere in the years, multiple years, but I don't have anything to back that.
Thank you.
I don't think anybody has anything to back that.
Yeah.
It's a good question.
Yeah. Thank you for that answer. And I'm sure that goes back to, having that reliable news source and just continue to check up on as updates come, right? So the next question is, I have heard clients say the vaccine causes inflammation. What is the best response to this statement?
Inflammation is definitely, I think that's something as far as a local a local reaction to the vaccine and the pain and they may feel after the shot. I think the best things, kind of doing or one, talking to your doc and seeing if certain medications, Tylenol, et cetera, are okay for you to take. I think if you're not into medication, I totally understand. I think ice, elevation, a little compression, any topical kind of lidocaine patch, etc., might be helpful.
Great, thank you. I did mom eyes there for a second, so sorry for that, everybody. So then the next question is, are we contagious if we have symptoms post-second dose? How do we respond to the concerns about the effects of the vaccine? So anyone want to speak to that one?
So when you're saying post-second dose, it's after 2 weeks and they did everything correctly within those 2 weeks, I'm assuming?
That's what I have for the question. So so if we have
when they say symptoms, like, are they tested then? That's like did they if they, you might have, like, with symptoms, you're talking about symptoms I think that are related to the vaccine is my guess.
So Peggy, if you want to type more into the Q&A box for us to clarify and understand your question well, it looks to
the key thing, sorry, not to interrupt you, Kristen, is that once you get vaccinated, you can still have URI, upper respiratory infectious symptoms, fevers, cough, runny nose, from, again, the common cold, from the flu, so after you get vaccinated, I think, and again, maybe she's typing in more stuff to her question, is, can you have symptoms of COVID? Yes. Will you have COVID? Less likely if you've been appropriately vaccinated.
Yes, and I believe that was Peggy's question because she said yes after the vaccine. So Peggy, let us know if we answered that question fully for you. You can type more in the chat. And the next question is, so what do you say to people who say the vaccines have not been tested enough? This is directed mostly to Dr. Marcus or Dr. Clara.
I think that, right, like if you look at the sample sizes, like I think Mrna and Pfizer was about like 76,000 people, something like that. If you look at Johnson & Johnson, it's around 45,000. I mean, these are really large sample groups. I mean, that it went through all the FDA testing, which is quite rigorous. It went through the phase trials. I mean, if at a certain point, it has to also be like, okay, and now at this point, 100 million Americans have been vaccinated, and we see that it seems safe, and it helps to reduce the spread of COVID. So that is what I would say. It seems like the vaccines have been very positive at doing what they were made to do, and they have been rigorously tested by very large sample sizes.
Yeah, no, I agree. And there's been other viruses, a lot of patients tell me, oh, it came out so quickly, how'd they get it? And, I agree, it did come out very quickly, but there are other viruses similar to COVID's kind of morphology, protein structure, you want to say, MERS, SARS, etc., that we kind of had information on, we used to kind of help make this vaccine. So yeah, it did come out quickly, but we did kind of have some information kind of on COVID, similar kind of cousin vaccine, cousin viruses, et cetera, if you want to say, that we helped. And like Claire said, yes, it went through all FDA, issues that needed to happen to get that FDA approval. So you can always kind of go back to that.
And piggybacking on what Marcus had said, some of this technology, like these RNA vaccines, like a lot of this research dates back 10 years ago. This isn't something that just sprouted up with coronavirus. It's something that people realized they could utilize in a situation like this because it was really pressing to have something come out quickly, right? Or as fast as possible. And then with the Johnson & Johnson, with the adenovirus type viral vector, they also actually have an Ebola vaccine that uses some of that same technology. So a lot of this isn't like new technology, right? It's just something that they used for a new virus.
And I think that one thing I know I've heard is people saying hearing that it's a new vaccine. And then I think that's where the fears kind of come into. So I think that going back to, again, I love that reliable news source piece of advice for us. So, all right. And then, so we will go to the next question. So what do you tell a client that asks, why do I have to wear a mask if I've had the vaccine? Is COVID, and then also, is COVID tracking requirements an invasion of privacy? So maybe that first part of the question. So I've had my vaccine, why do I have to wear a mask?
Mainly what I've read is that it's for the new variants. You saw the one graph I had where it went from the orange to the blue, right? So it's kind of, at least from what I understand, it's more that issue. You don't want to get the new variant. And then if you had the new variant and you were someone who is fully vaccinated and not wearing a mask completely, you obviously would have a high chance of spreading it because you would be under the impression you couldn't get COVID, right? And then you would just go about spreading it. And the newer variants tend to actually be more infectious too, correct? So that's what I have to say about why you should wear a mask still. I still wear a mask still and I'm fully vaccinated, so.
Okay, and then the other part of it is COVID tracking requirements an invasion of privacy? And I know I can speak to, you take your vaccination card, you can go get a free Krispy Kreme donut, or things like that, where you have to start showing your card. So what would we maybe say to our clients or our practitioners who are listening who might have that question come up in their practice?
Yeah, it's going to be a huge issue when it comes to HIPAA. So HIPAA is something that the healthcare industry practitioners have to adhere by. But it's not my understanding that non-medical industries have to adhere to the same privacy laws. Now, the question you have to ask yourself is, do you want people to know information about your health that they could either use against you, use it against you, or provide gifts? A lot of people aren't going out giving their test results. If they go to the OB doctor, they're not sharing that. Sometimes people are doing that with HIV. But when you think about this particular case, it could potentially cause stigma around people who have had the COVID test, or folks who don't have access to a vaccine, around shaming and just, feelings of like being left out. So we want to be mindful about how we're using our vaccine selfies, or using it to be informational, because everyone, like, Dr. Claire Williams said, is that it's a privilege. Not everyone has access to this. And these tend to be marginalized groups, under-resourced groups who are also Black, Indigenous people of color. So are we using this to uplift folks who are at greater risk? Again, the HIPAA statute is for health professionals. It doesn't apply to Dunkin' Donuts or Krispy Kreme. And do you want your personal information out there like that? I think that's going to be another concern around privacy and how technology, how we share information, just to be mindful of that.
Thank you for that. And kind of piggybacking off that, we were talking about how some of the harms with vaccines and, in some of our different communities over the years. So I have another question to read. So what are some strategies that you all would suggest to start to heal from some of these historical harms of healthcare testing on Black and brown bodies? And how can we work with our patients to address this? If this kind of comes up with them, what are some ideas you might have for that?
I would say be patient. I'm not excited about getting a shot or a vaccine. I don't like needles. I can't say I've always felt like I've had the greatest warm welcome, that we want to have in the healthcare industry, is making everyone feel seen and supported. Everyone doesn't get that type of treatment of care. And so if you're working with patients or clients who are not interested or have expressed disdain for it, to be mindful of their own unique experience. A lot of this is not historical, that folks today are still being treated poorly. There is racism in healthcare. And so it's not something that we have to look so far back to know that people have unique experiences. So I would just recommend being patient. If they would like more information, to ask, is it okay if I share more information? Assume, don't make the assumption that they don't have the information or that they're ignorant or, wanting to cause harm. To be careful about the assumptions we make.
And it sounds like validating where they're at and kind of like really creating that space to validate their process with this, because this is different for everybody. It's such a unique thing
Right.
for us. Yeah.
And in the social work field, part of our ethics is folks have a right to self-determination. Mm-hmm. Even if I think it's great and wonderful that everyone has a right to make their own choices, even if it looks like something I wouldn't choose. So honoring our unique experiences, if there's an avenue to have a dialogue, if you have that relationship, do that. But, approach it with some kindness, some consideration and mindfulness.
Yeah, I think Leticia brings up a good point that, some people, you're not going to be able to change their minds. Respecting that decision, I think, is important to then discuss with them other ways, that we've talked about, keeping ourselves safe and making sure and focusing in on that. But like everyone else said, I think presenting the information, being patient, understanding where each person is coming from is key.
Thank you for that, everyone. So moving to the next question, what would you say about how differently states, communities, so different parts of our country, I guess, are reacting to the pandemic? So, mask versus no mask, closed versus open, fear rhetoric versus no fear. Any thoughts on that?
Well, I'm interested in their thoughts. What is your thought? Whoever posed that question.
So, Christy, I don't know if you want to share more about your thinking about that question. Like, how do we talk to our clients who might live in a different community than we do, that has different, is open or isn't open, or family members, extended, people who live in different parts of the country?
I would say start by getting to know someone before making that assumption. What we're seeing in our country is very indicative of how individuals make different choices for themselves. Whatever feels right to you, whatever you choose will be right for you. But what we're looking at is the impact. So there's a virus, there's lots of viruses that exist. This one has been very deadly. And I have not experienced this in my lifetime. My parents haven't, my grandparents haven't. So it goes back further than anyone that I know who's alive who can say they've experienced this type of impact from a virus. Not only are folks getting sick, jobs are gone. Kids aren't at school. You can't just freely go to the grocery store. Our normal day-to-day life has been greatly changed. In some aspects, there's good. In other aspects, it's been really, really difficult. And so it will come down to your personal choice of how you want to approach it. We know that pointing fingers and judging folks does not work. A new approach is taking the time, being patient, seeing what you can do. And there's things that we can do to remain safe. If you choose not to vaccinate, will you keep distant? Are you in agreement to wearing a mask? Are you mindful about the times you go to the grocery store? There's other ways to manage this. The issue is that folks have not adhered to even those things. So, sitting with yourself. And I think we do that within communities, with our friends and our families, we have this conversation. Those are going to be our outlets, encouraging them to connect to folks who they trust. Maybe you're not the person they trust to open up to like that, and respecting that, but encouraging them to go, do you have a relationship with your doctor? Message them as much as you want. Contact the advice lines. Anyone who has coverage with, I hope everybody does by now, medical coverage, call those advice lines. There's clinics in our communities that walk in there if you can and see if there's someone available to answer their questions. The truth is there's not a lot of resources. There's a lot of questions that can't be answered, but finding one avenue, one business, one person that is reliable to you, that you trust, to stay connected to how you can keep yourself safe.
I'd actually like to piggyback on that because Leticia, I think you said that extremely well. And I think, you know, there are a lot of social workers on this call. And the thing that we are forced to reckon with and the thing that's extremely and deeply unfortunate is that the pandemic happened amid very, very deep political tensions. Our social context absolutely matters, and you know the unfortunate circumstances that not only are social workers and providers as a whole dealing with how to support patients and families around the pandemic, but we're also supporting them in the context of all of these other social issues, social as well as political issues, and honoring that context is so extremely pivotal in the ways that we support people because folks come from different spaces. They get access to information in different ways. Obviously, folks who perhaps live in rural spaces might get access to different types of information than folks in an urban setting or folks that have ready access to people and social ties, folks in different states, folks in different counties. The reality is that our leadership looks extremely different from state to state. And that then trickles down into the ways in which we are regulated, the ways in which we are informed, and the ways in which we are directed to act in response to this virus. And so, I think providers as a whole, I think the general theme has been, to really individualize the ways in which we're treating and supporting folks, because the reality is that not all of us are experiencing this in same ways. And everybody has different pathways in which, that have informed the ways in which they are then processing these compounded socio-political issues. And so, I appreciate what Leticia lifted up is that, really we want to honor that and create space for conversation around it and not have it be the elephant in the room because, there are too many elephants, unfortunately, now, right? If there's tension, you're trying to shy away from politics and religion and, the racism and all of these things, right? But our job as public servants is actually to address that head on because that's the only way that we can support individuals by being transparent, humble, and asking questions and operating from a place of curiosity because they lead the ways in which we support them, and we need to create a pathway that they can trust us to do that. So thank you for lifting that up.
Thank you, Deborah. All right, so we have a couple kind of groups of questions now. So some are really specific that you might all just say kind of that's better to ask your specific doctor about. But one question is, as an employer, how would you recommend dealing with employees that don't want to get the vaccine? I don't know if anyone wants to speak to that.
Create alternatives. So if they don't get in, a vaccine, what is going to be the policy for keeping everyone safe? That I know, like in the hospital, you have, as a medical social worker, you have to get like a TB, you have to get a flu, and if flu shot, if you don't do that, then you're required to wear a mask the whole flu season. So, setting up some parameters is giving some options. Again, to enact choices on what someone chooses to do to their body is very personal. So I think that's why the emotions are really high around this this issue, this need, because you're telling me what to do with my physical self. It's an emotional experience. So creating some options, maybe they can work from home, or you set up some outdoor space. I don't know, but giving people options is going to be more welcome than telling folks what they have to do.
Thank you for that. And then, so a couple specific questions. One is about, sorry, y'all. Is it true that it is better to take Tylenol as opposed to Advil for vaccine side effects? Also, is it okay to pre-treat for side effects? And then the other part of that is another kind of question is, will there likely be a flu/COVID combo vaccine in the future?
I mean, as far as treating with Tylenol versus Advil, again, I think Kristen, you kind of hit that on the head. You know, that's a more primary care doc question. Advil, ibuprofen, you know, those medications can have more effects on your kidneys versus Tylenol, which can have more effects on your liver. You know, so, you know, for a healthy you know, for a healthy person with no significant underlying background, you know, Tylenol or ibuprofen, I think taking at the appropriate dose, I think is a coin toss on which one you want to use. What do I know if one is better than the other? I don't. I don't know if Dr. Williams can speak to that. I can't remember the other question. I'm sorry. I don't know if anybody else.
Well, for the Advil one, I know Advil kind of reduces, or ibuprofen reduces inflammation. So maybe you want a stronger immune response with it, right? Because that's what you're trying to elicit. So maybe you could go more for Tylenol. But again, this is something, as Dr. Williams said, you should ask your primary care physician, right? As far as will there be a flu COVID combo vaccination in the future? I'm not sure, right? The vaccines work differently, so I think it would be hard for them to combine it. If I really were to get into some fun science, I know they're trying to find a universal vaccine, but that's completely something that is going to happen in the future. It's a little science fiction now, but but as far as I know, in the near future, I wouldn't imagine there being a COVID flu vaccine. Maybe Dr. Williams can.
Yeah, no, I agree with that. There's no test currently for both of them. They're two separate tests. You order them separately. I don't see that happening, or at least I haven't heard of anything like that. Would be nice though.
Yeah, they're talking about a universal vaccine. I watched a talk on it. It was really cool. But yeah, sorry, digressing a bit.
No. I thank you so much for all of your thoughts. And I just want to really clearly say to all of the people with us today, so if you have any of those really specific for the vaccine, like should I pre-medicate, what kind of, definitely we want to make sure you're going back to your personal physician. And if your clients are asking you for that advice, giving them that same advice. I just really want to add that disclaimer here. And then another question is, and also I didn't even think about how like the flu vaccine and the COVID vaccines are different. So thank you for even just saying that. I never thought of that. Anyway, so Dr. Williams, what advice would you give to someone who is pregnant, get vaccinated or not?
I think that would definitely be something that you talk to your primary care physician about. I can say that there is a paper that vaccinated mothers pass COVID antibodies to their baby in utero and breast milk. This is preliminary data, right? I would never tell someone that they should get vaccinated if they are pregnant. If you look at all the studies, in the studies they have, no one who was pregnant signed up. But women who participate in the studies later on found out they were pregnant. So there is a small sample size they're looking at. And it does seem that there might be some positive benefits actually for getting vaccinated prior, right? But I wouldn't actually say definitively or give anybody advice. It's something you would talk to your doctor about.
Great.
Yeah, I'd piggyback on that. You know, like Dr. Williams said, there's testing on pregnant women is just not done, you know, flu, etc., unless it's unknown, like Dr. Williams said. So, you know, having information on this is just not really possible, I guess you could say. I know that there are, you know, starting to look into testing and or looking into response. From my, you know, review, there hasn't really been any significant side effects. But obviously I know that there's, you know, the questions as far as babies down the line. And again, we just don't have this information.
Thank you. So then a couple of other questions. So I know that, you know, if people are asking questions and things, what are some reliable resources to, you know, track all this information? Are there any really strong resources you would suggest people follow to get accurate, up-to-date information about COVID vaccines?
One of the easy things, because I mean, a lot of what I get my information from would be like science journals, like Nature or Science. They're going to be really kind of dense for people to read. But what I've been doing lately is to follow people who are scientists on Instagram. I feel like, or social media, Facebook. These people really break down the science in an easy to understand way. One of the people I mentioned was Dr. Kizmika. She's great to follow with COVID. She made the Mrna vaccine. She has such useful information. I actually got the paper with the pregnant women and breast milk from looking at her Instagram page. I think that you can use social media to not just follow your friends and celebrities, but to also follow people who are experts in the field. So I would suggest that actually. I could give a few scientists I follow that I think are really great if you want, even if people have Instagram.
That would be great.
Yeah,
Yeah,
the idea, yeah,
go
go ahead.
ahead. No, go ahead.
I was going to say the idea is find what works for you. For some people, they like to read the journal articles. For some people, just give me the facts, real bullet points. There's some people who I want to hear the leaders and what they have to say about it. For me, I like to look at the whole person. What are your beliefs on this group of people and how you, what's your approach to care? So I look at clinics that I like, whether or not I like how they deliver their care to people. To me, that's who I looked as trusted, reliable folks, because they're more mindful of like how folks receive their information. So finding what works for you. Some people is like, I like their images. It sticks out to me. Again, I can't judge how you get your information. I just only encourage you to stay connected to what's happening when it comes to staying safe.
Yeah, I think gathering information, especially from multiple resources, is hard, and understanding who's might have underlying agenda. I'd like to agree with everything said by the panel. I think where I typically get a lot of my information is from Up to Date, which is just a website. But yeah, I definitely agree with a lot said by the panel.
Thank you. So a few more questions here. Thank you so much for this discussion. So why are clinics asking people before receiving the vaccine if you've been exposed to COVID? Is it problematic if you have been exposed to and then received the vaccine? I actually wondered this too when they asked me.
I might think that they just want to keep track of everything, right? Because as I mentioned, like they did do the trials before and they're kind of looking at the efficacy. So it might just be that they want to see like out of the people who were vaccinated and had COVID, like did they get it compared to people who are just vaccinated, just to kind of maybe make comparisons between the two. I'm not 100% sure. I really do not know. That would just be a guess that they might want to just look later on down the road for.
Yeah, I'm sure there's definitely some information that's probably being gathered. I think a lot of it from a medical kind of standpoint is, concerning about side effects. If you currently have the virus or giving you a vaccine for the virus, worrying about increasing side effects and in patients that might have underlying issues that might cause more complications down the road. I think being kind of cognizant of that as medical providers and maybe pushing that vaccine for that person a week back might be something a provider might talk to a patient about. So I think, on top of what Clara, I think that's Dr. Williams, I think that's a great, point that information is also being gathered from this. I think that's also a topic to kind of bring up.
And then one kind of question for later follow-up. Somebody asked is it possible to get a link to that paper/research about pregnancy and the vaccines? I don't know, Dr. Clara.
I can see. Unfortunately, in science, some papers it's like firewalled. It's weird. I need to check and see if that's an open access paper, or I could try requesting from the authors. But yeah, in science, it is sad that you have to pay for papers, actually, which is too bad.
And Dr. Clara, if you happen to find it, just feel free to email it to me and I can email it out to
Okay,
them.
that sounds good. I definitely will check on the paper though, to see if I can freely share that. And I should be able to, so it shouldn't be an issue.
And if you don't mind, Clara, also in the chat, if you can type the folks that you would recommend following. I think folks are interested in that. And Leticia as well, you mentioned like a local clinic. If you don't mind typing in the name, the folks are asking about that as well. Thank you.
Okay, and I'll see real quick if I can put in the article. Let's see.
And then we do have another question. So it's more about if you're familiar with any data around related to children and vaccines at this point for COVID, and then or if schools, and if like schools are hotspot or big contagion spot. If you have any thoughts on that?
As far as children, they're not testing, and to my knowledge, I think the youngest age is 18 or 16 for the vaccine. So currently children aren't being vaccinated. And I don't have any information as to why that is or when that will change. As far as schools and children being a hot spot, I also don't have any information on that. I assume that, with kids being around kids, the close, the touching, I can see how, contagious this virus is, how that area could be considered that, but I don't have any background or information to say that that's true. I also don't have any children to know if schools are opening back up soon, but yeah.
Thank you. I always start talking when I'm on mute still. So thank you for that. And I think, so coming from the lens of working, social work, obviously, and different people who might also believe some conspiracy theories, what would you kind of offer up to our people listening? If somebody comes in and says, I'm not going to get the vaccine because of, and then a conspiracy theory, it's a microchip, or it's to control me, or, something like that, I don't know. Any thoughts on that? If people come up with some of these other outlier things, Leticia?
Again, it is someone just making a statement, or they want to have a dialogue. So kind of testing the waters, because it's an everyday occurrence that we're hearing about COVID and the vaccine. What role do you want to play at this time? Do you want to dispel conspiracy theories? Do you want to have open dialogues? You have to check what's your capacity, your energy. Some people are tired of it, tired of talking about it. I'm tired of hearing these conspiracies. So find your approach on how you want to take care of yourself and manage through this time. You may take the stance that says, I don't want to hear it. I would not accept that. Or you may just let people talk and go on about your life. If it, what is your role? Are these just people in your community? Are these people you work with? Who are these people? Again, it's about relationship. How can we build relationship to have a better understanding of how we're going to go about managing this crisis? I know a lot of people have become very anxious and depressed. It's been a whole year and have not been able to have weddings or attend graduations. So some people are a little bit more on edge and testy. There's some people who they're looking for answers, and a conspiracy provides that for them. Again, it's just checking in with yourself and how you want to respond. Again, this is an individual stance that I don't think a lot of people had time to explore with themselves of how are you managing? What is it that you need? Because you can impact your immediate community without trying to change the mind of the whole country or the whole world. What's going to be worth it for you? What's meaningful for you?
Thank you so much. And before I turn it back over to Deborah, do any of our panelists have any last thoughts? And also, somebody put an article in the Q&A. I'm not able to copy and paste that or share that. So if you want to put that in the chat, please do so. It's just an anonymous attendee. So Just wanted to share that. So any last thoughts before I turn it back over to Deborah? And thank you so much.
I like the article the person in the Q&A sent. That's cool. Thank you, whoever did that.
Parting words, stay safe, stay informed, stay empowered that there are things that we can do to take better care of ourselves and our communities, but find the approach that's going to work for you, because that's how we're going to sustain ourselves for, we don't know how much longer. You know, we thought this thing would have burned off by summer last year, and it got worse. We have a chance to make it better. Find how you want to make it better for yourself and the people you love and care about, and the people you don't love, but also care about.
Yeah, happy Social Work Month.
Yeah. And thanks for having me. This was nice.
All right, Deborah, I'll turn it back over to you.
Thanks so much. I just want to share a heartfelt appreciation for Drs. Williams's and Leticia for all of your amazing work. I know working the front lines and studying, the science, it's a moving target. And so just appreciate you all for the work that you do. And Leticia, I don't know if you want to type in Urban Health Group's website into the chat. I'm sure folks will be interested to hear more about the resources that you have to share as well. A big thank you to all of our folks who joined us today. Just some housekeeping. We'll share the PowerPoint, Dr. Clara's PowerPoint afterwards in conjunction with the evaluation. So please do let us know what you thought. And what you want to hear more about. We, again, lean on the field. And so whatever you're interested in hearing about, we certainly want to be responsive to that. So enjoy your evening. Stay safe, everyone. And thank you all for being out there and doing the work that you do. And we appreciate you all. Take care.